What is dose-dense chemotherapy for lymphoma? Have you ever wondered how doctors can make chemotherapy more effective? One approach they use is called dose-dense chemotherapy. This method involves giving chemotherapy drugs more frequently than in standard treatments. In standard chemotherapy, treatments are usually given every 3 weeks. This schedule allows the body time to recover, especially the bone marrow, which can be affected by the drugs. However, in dose-dense chemotherapy, the same drugs and doses are administered more often, typically every 2 weeks or even weekly. The goal of this approach is to reduce the time that cancer cells have to regrow between treatments. For patients with non-Hodgkin lymphoma, particularly those with aggressive or high-risk forms, dose-dense chemotherapy can be a key strategy. By delivering chemotherapy more frequently, doctors can better target the rapidly dividing lymphoma cells. This can potentially lead to improved outcomes when compared to standard chemotherapy schedules. The reasoning behind dose-dense chemotherapy is based on how tumors grow. After initial treatment or surgery, any remaining cancer cells can start to grow quickly. By shortening the time between chemotherapy cycles, doctors aim to prevent this rapid regrowth. While the dose of each treatment may stay the same, the overall intensity of the treatment increases because the recovery time is reduced. It's important to note that dose-dense chemotherapy can lead to more side effects. One common issue is a decrease in white blood cell counts, known as neutropenia. To help manage this, supportive treatments like growth factors are often given. These treatments can help the bone marrow recover faster and lower the risk of infections. Patients undergoing dose-dense chemotherapy need careful monitoring for any side effects or toxicity. This treatment is generally considered for those with aggressive lymphoma subtypes or higher risk profiles. Each treatment plan is personalized, taking into account the individual patient's health and circumstances. In summary, dose-dense chemotherapy for non-Hodgkin lymphoma involves administering standard chemotherapy drugs more frequently to enhance treatment effectiveness. This approach aims to limit tumor regrowth while incorporating supportive care to manage increased side effects. Always consult with healthcare professionals to understand the best treatment options for individual cases.